So when we refer to spasticity after stroke, what we're referring to is muscles feeling tight or having an abnormal amount of tension in the muscle due to the stroke injury. So people might have more difficulty moving their muscles because they feel so tight, and it could impact on how they do their activities of daily living as well as walking or other mobility. After you've had a stroke injury, the damage caused to the brain is thought to be the reason why you have the spasticity or the increased muscle tone. And the current belief is that the ability of your nervous system to hold back that extra electrical impulse from the brain is what is actually the problem with stroke. So with the stroke, your body has a harder time inhibiting those impulses, and that's what's leading to spasticity. So the typical pattern of spasticity is in the upper extremity. People tend to have more of a flexed posture. So your elbow might be flexed. You might have a hard time extending your elbow. You might have a hard time opening up your hand, for instance. And in the lower extremity, you could have a harder time with bending your knee or even moving your foot up and down. On the negative side, spasticity can impact on how you perform your activities of daily living, like brushing your teeth, eating, getting dressed, things of that nature. And in the lower extremity, specifically, it mostly impacts gait and your ability to move around in your environment. So there's many ways spasticity can be treated after stroke. First way is physical therapy and occupational therapy, range of motion exercises, keeping the joints mobile. The next step would be different medications that can be used for spasticity. Going down the line further are things like botulinum toxin injections. Botulinum toxin can help relax the muscle so that you can move more. And then there's some other more invasive methods as well of controlling spasticity with things like pumps and other interventional methods. For the lower extremity, different sorts of braces can be used to control the spasticity, to hold your foot in a nice position so that when you walk, you don't snag your toe and trip and fall. In the upper extremity, there are things like what we call resting hand splints, or different splints that can help hold the hand in a nice position so you don't get too tight in any one direction. So if someone is worried about the long-term consequences of spasticity and stroke, they should really speak to their doctor. I find that a lot of folks just kind of live with these things and don't bring them forward to talk to their neurologist or physiatrist to see what else can be done. Especially folks who have been living with spasticity for a long period of time, there can be new things that come out that they may not be aware of. And a lot of people really aren't as familiar with some of the more interventional techniques like botulinum toxin injection and things of that nature.